Good morning, viewers, and welcome to the YouTube channel Dr. Rakha. I wish all my dear viewers a very happy and prosperous New Year 2019. This presentation on waterborne diseases is important because large population of India suffer from the waterborne diseases. Let's check on this critical and very important issue. First question is, what is a waterborne disease? The disease is caused by pathogenic microorganisms that are transmitted through water are called waterborne diseases. As per World Health Organization 2018 report, the contaminated water and food prepared with the contaminated water is a major health concern in our country, India. Who should know this information contained in this presentation? Everybody who handles water and food should know how important are the hygienic measures. And also, we need to know what the infectious contaminants in water can lead to. How waterborne infectious pathogens get transmitted? That's an important issue and concern. Number one, drinking of contaminated water. As we see in this picture, we should never ever drink water from the rivers, canals, ponds and other water bodies because that water may be contaminated with several pathogens. Number two, the infection gets into our body by eating of contaminated food. Usually flies bring pathogenic organisms to our food and contaminate it. Once we eat that food, pathogens get into our body. Then transfer of saliva, if one of the two who are sharing this drink or when we are eating the food eaten by others or left over by others, then infection present in the food transmitted by the infected individual gets into our body. Bathing with contaminated water is also one source of transmission of pathogenic organisms. Even washing hands with contaminated water will also lead to transmission of many of these organisms. What can happen when we get this transmission of waterborne disease? While diarrhea and vomiting are the most commonly reported symptoms of water, other symptoms can include problems related to skin, ear, respiratory system, eyes, etc. Let's discuss one by one these diseases which are transmitted through the water. First is and most common is amoebiasis. It's caused by Acanthamoeba histolytica. The transmission is usually from hand to mouth when hands get contaminated with this organism and we eat the food without washing the hands, then the organisms or cyst of amoebia get into our body through GI tract. The sewage, non-treated drinking water, flies in the water supply and saliva transfer if the other person has the disease are the common transmission methods. What happens when the infection settles in our GI tract? Abdominal discomfort, feeling of fatigue, weight loss, diarrhea, bloating in the tummy, and fever sometimes are the clinical symptom of amoebiasis. The second important disease of amoeba is Acanthamoeba keratitis. We can see the infection of eyes in this picture. The free-living amoebae found in surface water, tap water, swimming pools, and even in the contact lens solutions. Cleaning of contact lenses, those who wear the contact lenses, once they wash or clean the lenses with contaminated water, the organisms can get onto the eyes. Eye pain, eye redness, blurred vision, sensitivity to light, sensation of something in the eye, and excessive tearing are the very common symptom of this problem. The third important disease transmitted by contaminated water is Giardiasis. This usually follows fecal oral or hand to mouth transmission method. And the most common intestinal parasite present in India today, and it is transmitted by untreated water, poor disinfection, pipe breaks or leaks, groundwater contamination, etc. Once this Giardia organism settles into our GI tract, diarrhea, abdominal discomfort, bloating, and flatulence are very common symptoms. The next disease which is transmitted from the water is called botulism. These bacteria enter an open wound from contaminated water sources. It can also enter the GI tract through consumption of contaminated drinking water or food contaminated with this bacteria. There will be dry mouth, blurred or double vision, difficulty in swallowing, muscle weakness, difficulty in breathing, slurred speech, vomiting, and sometimes diarrhea will be the common clinical symptoms. Death in this case is usually caused by the respiratory failure. The very common disease which we'll hear is cholera. The drinking water contaminated with this bacterium, and in severe form it is one of the most rapidly fatal illnesses. Symptoms of cholera include very watery diarrhea, nausea, cramps, nosebleed, rapid pulse, vomiting, etc. The hypovolemic shock in severe cases, at which point death can occur in 12 to 18 hours. So we have to be careful and not drink the contaminated water. Number 6, problem caused by the waterborne disease is E. coli infection. The water contaminated with the bacteria is the source of infection to human beings. It leads to mostly diarrhea and can cause death in immunodeficient, very young and elderly persons due to dehydration, which develops very rapidly in E. coli infections. The seventh problem is Leptospirosis and is transmitted by the contaminated water. Water contaminated by the animal urine, which carries the bacteria, becomes the source of infection. It begins with flu-like symptoms and then it gets resolved. The second phase then occurs involving meningitis, liver damage, and renal failure will be the cause of death ultimately. The eighth problem is called Otitis Externa, which is also known as swimmer's ear. Swimming in water contaminated by the responsible pathogens is the cause of this disease. The ear canal swells, causes pain and tenderness to the touch. The ninth problem we are going to see is Salmonellosis. The drinking water contaminated with the bacteria is the source of infection, is more common as a foodborne disease, and the symptoms are diarrhea, fever, vomiting, and abdominal cramps. The 10th problem is the typhoid fever. It's very common. Ingestion of water contaminated with the feces of an infected person is the source of infection. The disease is characterized by sustained fever up to 40 degrees Celsius, profuse sweating, diarrhea may occur in some cases. Symptoms progress to delirium, spleen and liver enlargement. In this case, it can last up to 4 weeks and cause death of the infected individual. The 11th problem, which is transmitted from the contaminated water, is severe acute respiratory syndrome. We can see the picture of infected lungs. The virus manifests itself in improperly treated water and can cause fever, myalgia, lethargy, gastrointestinal symptoms, cough, and sore throat. The 12th problem is hepatitis A. This is caused by a virus, and the virus manifests itself in water and food and causes the symptoms of like fatigue, fever, abdominal pain, nausea, diarrhea, weight loss, itching, jaundice, and depression in many individuals. The 13th problem is the hepatitis E. This again is caused by a virus which enters water through the feces of infected individuals, and this disease causes fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, jaundice, dark urine, clay-colored stool, and joint pain, etc. The 14th problem you might have seen throughout India is polio, or called poliomyelitis. The virus of this disease enters the water through the feces of infected individuals. This virus, once settles in the body, it causes delirium, headache, fever, and occasional seizures and spastic paralysis. It may be like non-paralytic meningitis in 1% of the cases. The serious symptoms resulting in paralysis or death are also reported many times. There are some other diseases which are not very common but are transmitted by the contaminated water, by the pathogens which cause cryptosporidiosis, cyclosporiasis, Giardiasis, campylobacteriosis, dysentery, cryptosporidiosis, cyclosporiasis, primary amoebic meningoencephalitis, campylobacteriosis, dysentery, vibrio illness, and acute gastrointestinal